Okay, hello everybody, and welcome to the next episode of the Round Table here at Pure Plastic Surgery. And today it's a little bit different because we're going to be answering some of the most common questions that we get from people that are not familiar with plastic surgery. All right, so here's the first one for Dr. Wigriff, and it is so the letter or the question says, "Hi there. I've always had one breast larger than the other, and it really affects how I feel in clothes. Is it possible to achieve symmetry through surgery, or what options are there for me?"
So that's a great question and a common question we get because at the end of the day, most people have some degree of asymmetry between their breasts. And depending on how significant that is, there's multiple different things we can do for that. We can do different type of lifting procedures or reduction procedures to make the larger one match the smaller one, or we can do augmentation and a combination of a lift, and we can do two different size implants. So we have a bunch of different tools at our disposal to help improve symmetry. We're always aiming to improve and maximize symmetry, but we're never able to achieve perfect symmetry. So you also have to keep that in mind.
Yeah, and when I read this question, one of the things that I thought about was tuberous breast deformity. I think that a lot of people have that and they don't know that it's even a condition. It's basically that the breast develops like a tube. So the breast is narrower, it's a little more constricted, and the areola is wider because the breast is kind of pushing it out. A lot of these patients have asymmetries, and yes, like Dr. Weir mentioned, all of those options are available to kind of reshape the breast and try to achieve better symmetry.
And the final option that I forgot to mention was we also have fat grafting to the breast as a alternative to implants if we just need to restore a little more volume on one side versus the other.
Yeah, exactly right. That's what I was going to say. So the final option is that. Honestly, what options do you have? There's really no or very little non-surgical options. Like you have a breast asymmetry, you're going to have to do some sort of surgery to improve that. There's really nothing that you can do that's, like working out or some other option like that. The only thing I would say is maybe if you have very slight asymmetry and you just need a little bit more volume on one side, then the only other possibility would be the alloclay, which is the off-the-shelf fat that we have here at Pure Plastic Surgery. And that could work if you literally only need like maybe 50 to 100 cc's max of added volume to one side, but the nipple positions are already in a similar position and everything else. But other than that, you're going to need surgery.
So if you have any questions about either of these procedures, please check us out at pureplasticsurgery.com where you can do a consultation right there.